In terms of radio frequency skin tightening, this is the holy grail that us plastic surgeons and dermatologists are looking for. We're looking to tighten skin without cutting and pulling. And there have been devices that have been developed over the last 20 years to try to increase to produce heat or create collagen buildup in the skin. And if you create a lot of collagen buildup in the skin acutely, that collagen contracts and will tighten skin. So there have been procedures like thermage, there's Ultherapy, and now there's a host of various radio frequency devices which produce heat. And the heat is driven deep into the skin depending on the type of radio frequency device. Radio frequency devices are not lasers. It's a different kind of energy that's introduced into the skin. There are other energy devices, laser and ultrasound, which can actually produce heat in the skin. They're not as common as the radio frequency devices. I was responsible for developing a procedure called ThermiTight, which was thermi-controlled radio frequency devices. So what it was you knew exactly at what temperature the skin would be clinically burned. If one can maximally heat the skin, the dermis and the underlying tissues, without creating a clinical burn where you see a burn, then one gets the most effect on the skin in terms of building up collagen. So the device was developed in such a way that one could maximally heat the skin. There was a temperature cutoff point at which one stopped treating, and you didn't get a burn, but you got the maximum heating of the tissue. There are lots of other new devices today, but possibly the best device to achieve skin tightening is a needling procedure with heat, where radio frequency heat is transduced through the needles into the skin to create the maximum heating effect and injury effect to the skin and the deep layers without getting a burn. So we are seeing improvements up to 30%, 35% with these newer devices. Before, these devices usually created a 10 to 15%. So we continue to develop technologies to try to heat up and tighten that skin without having to undergo surgery. So we call it a non-surgical facelift, because we don't do surgery and we can lift the neck and the skin with these devices. So radio frequency skin tightening is not for everybody. One of the problems is that when a practitioner of any kind, whether it be a nurse or an esthetician or a non-surgeon or non-dermatologist who's administering these treatments, they might do these treatments on people who are not good candidates because that's the only device they have. They can't do surgery. They might not have other more radical non-surgical treatments. They will administer a radio frequency treatment to the patient, heat up the tissue. They will have to do it multiple times, and the patient might not be a good candidate because they don't have enough collagen already. If their skin is very thin and there's not much collagen in the skin, there's not much collagen to respond to the actual heating device. So patients are often very upset that they only see a minimal or no improvement. So one has to choose your patients carefully to make sure that they will get some improvement. And these improvements are anywhere from, as I said, 10 to 25%. If you can get a 20% improvement with a radio frequency device, it's tough to calibrate what 20% improvement is, but it's a more obvious improvement to the patient. It doesn't take away all the sag, just takes away a certain amount and makes the patient look better. If one can achieve that, then one has been successful with that radio frequency treatment. So believe it or not, it's the younger patient who has more collagen and the more thickness in their skin. Sometimes a middle to older age patient might have that kind of thicker tissue and they would respond. But patients with very frail skin or very thin skin, a straight radio frequency treatment is not going to help them much. That is where one brings in needling as well as radio frequency, or needling on its own to try to promote new collagen buildup in skin that doesn't have much collagen to start with. So with most radio frequency treatments, the downtime is just a day of redness. So most treatments today have downtime anywhere from 1 day to a week.